All right, a warm welcome to you from Geneva, Switzerland. I'm Rida Sadki. We're 47 seconds away from starting this sneak preview of Teach to Reach Connect 7. This is the networking event for health professionals, the world's largest such event in which you can connect with fellow professionals from all over the world in order to meet, network, and learn. I'm here with Charlotte and Boo. In just about 30 seconds, we're going to tell you everything you need and want to know about this event. In order to get ready for it, it's happening Friday, the 14th of October, 2022, and it happens on a regular basis. See you in 15 seconds. All right, a warm welcome to you from Geneva, Switzerland. I'm Rida Sadki. I'm here with Charlotte and Boo to give you this sneak preview of Teach to Reach 7. So this is the big event that will be taking place on Friday, the 14th of October. We're here to tell you all about it with many of you, especially if this is your first time connecting. Charlotte, what is the first thing you would like to say to someone who's going to be joining Teach to Reach for the very first time?
Thank you so much, Reda. What I would like to tell them is they should get ready for an unforgettable experience, because it's the one unique opportunity where they'll have to connect with other public health, primary healthcare professionals like them from across the globe.
All right, that's great, Charlotte. So let's. So on the 7th of March, over 6,000 health professionals from 110 countries committed to contribute to a global movement for Immunization Agenda 2030. Now, what happened in July is we learned through the latest data collected by UNICEF and WHO that the COVID-19 pandemic has fueled, and 2 years in a row going in now into the third year, the largest continued backslide in vaccinations in 3 decades. And so this, we said, that we announced in June, would be at the heart of Teach to Reach 7, which is happening this Friday. So on Friday, Charlotte, we're going to start with the women who deliver vaccines. And this is a collective of 138 women. Who are they, and what is the collective about, Charlotte?
So we have 138 women from 35 countries who came together to give voice to all of those women that are contributing to push forward immunization, and they are from all system levels. That is from the health facility to the district to the regional and national levels and even global level. And they come together to support one another to ensure that they tackle gender barriers to immunization.
So that is how Teach to Reach 7 will open on Friday, with 1 or 2 speakers from the collective of women who deliver vaccines, because what we're concerned about is the response to what we learned in July with the latest numbers from UNICEF and WHO, confirming what many of you are seeing at the local levels, and that is the continued backsliding in immunization, but also stories of strength and resilience. And that is what we will be highlighting during the networking sessions. Now, here is what's special about Teach to Reach. You probably attended many Zoom type webinars where you sit there, somebody presents, 1 or more people present, and maybe you get a few minutes of questions at the end. Teach to Reach Connect is very different. It is focused on networking. You press a button and you are going to find yourself talking to a fellow immunization professionals about issues that matter to you. COVID-19 related backsliding being the first one. But here are the 3 networking sessions for this Friday. The first one is the Ideas Engine. And that, Charlotte, is going to be where you meet with a fellow professional and you share an idea or a practice, something that you have done that has helped you in your context to build back better, despite the consequences or against the consequences of the pandemic. Now, networking session 2 is in partnership with UNICEF, and there we'll focus on interpersonal communication. Again, Charlotte, can you tell me what that means exactly in this context? IPC is also used for infection prevention and control. That's not what networking session 2 is about. It's interpersonal communication. Can you tell me what that actually means?
it's really about the communication that happens between the healthcare worker and the caregiver that comes to receive immunization services. Many a times they are called to interact with the users, with those people that demand for immunization services. And there is a particular way, particular techniques that they may need to use as immunization professionals to get them to understand the reasons why they need the vaccines, what to do, where to get them, you name it. And at Teach to Reach Connect 7, during networking session 2, it shall really be all about how you communicate with the caregivers that come to you for immunization services.
That's great, Charlotte. And now, networking session 3 will be about finding the root cause of your challenge. And so we know you may face many complex challenges. You'll pick one, and the question you'll ask is, well, have I found what do I think is the cause of this challenge or problem that you face in your work, in your immunization work? And then you'll ask, well, why is there this challenge? And you'll do this 5 times. And then you'll discuss that with fellow health professionals, fellow immunization professionals from all over the world. So those are the 3 networking sessions. But to bring to life what exactly that means, we've received hundreds of stories documenting what you are doing in the face of the COVID-19 pandemic to build back better immunization services and integrate them closely in other health services. Charlotte has pulled out from these hundreds of stories, Charlotte, you've pulled out 5 examples of the kind of learning we can do at Teach to Reach 7 on Friday, 14th of October. The first question is, what works to increase the uptake of pentavalent measles, rubella, and rotavirus vaccine? And Charlotte, I believe, if I understand correctly, someone who will be there in Friday at Teach to Reach 7, at least one person, has found an effective strategy to actually answer this question successfully. Can you say her name and where she works?
Definitely, Reda. So that person is Benedetta Locomusao, and she is a national level Ministry of Health staff from Kenya.
And she will be at Teach to Reach 7. And so if you, as you network, as you have these discussions, you can talk about your challenges, but you can also talk about the local solutions that you've been able to implement in your work and share those with colleagues from all over the world. Another example is measles outbreaks. And here, the question that many of you we know are confronted with is, how do you control measles? So how do you do outbreak response, but how do you do it in such a way that it strengthens routine immunization services? Can you tell us which Teach to Reach participant actually has faced this challenge and shared ahead of Teach to Reach already a local solution for how they were able to respond?
Definitely, Reda. So that experience was shared by Martin Atama Adiku, that is works at the regional level in South Sudan.
All right, wonderful. What about number 3? How do you get private health services to engage in immunization services? Which Teach to Reach participant was focused on this and will be bringing a local solution to Teach to Reach 7 on Friday, 14th of October?
Syed Ahmad Hussein Shah, a district level staff from Pakistan, shared that experience with us.
Thank you, Charlotte. And this is what Teach to Reach is actually all about. Teach to Reach 6 happened in June 2022, and every Teach to Reach participant received the insights from Teach to Reach 6. There are 2,723 contributions. Our insights unit distilled these insights into really knowledge you can use ahead of the next Teach to Reach. And of course, if you attend Teach to Reach 7, you'll be able to benefit from these insights, both during the event and even if you miss it, you can still get them. In fact, we'll be announcing the launch of the Immunization Agenda 2030 Knowledge to Action Hub on Friday at Teach to Reach. And this is because as we keep learning more with 47,151 immunization professionals active on the Geneva Learning Foundation's immunization platforms, it is not only about sending you information, it is about enabling you, supporting you to share what you know, your local expertise and experience with each other. And we've seen at Teach to Reach 6, we're already 12,398. I'm pleased to hear, and this is how we're going to close this information brief, that now for Teach to Reach 7, 13,676 people registered for this event. Now, if you have connectivity problems, I encourage you to listen to the podcast. And I haven't told you yet how, if you have not yet signed up, how you can actually get to Teach to Reach 7. So that is the last thing I will do in this live today together with Charlotte and Boo. Go to the learning.foundation website. So that's learning.foundation/Teach to Reach. And it is as simple as requesting your invitation. You put in your name, you put in your email here. You click on request your invitation. Make sure you read and follow the instructions that are shared with you, and you will be then able to attend. Wonderful. Thank you so much for attending this Teach to Reach Connect 7 sneak preview for the francophones pour les francophones. On se retrouve dans 20 minutes. For the francophones, we'll be seeing them at the half-past mark to share the same sneak preview with them. See you soon.